The Early Show continues now from the General Motors Building in New York City.
This morning in Health Watch, beauty at any cost. Baby boomers are driving the market for so-called cosmeceuticals. These are beauty aids that promise to work like drugs to make you look better. Dr. Michelle Copeland is a cosmetic, plastic, and reconstructive surgeon here in New York. Good morning.
Good morning.
Explain to us what cosmeceuticals are exactly.
Cosmeceuticals are products that are not drugs, they're not medical devices. And what that means is that they're not regulated by the FDA. So it means for the consumer that they have to be more educated to make sure that what they're getting is going to do what they want.
Okay, so they're not regulated and they're not supposed to use drugs, but some of them do incorporate prescription drugs. Is that correct?
Well, there are certain ingredients, like for instance retin A, which is a prescription. Lots of cosmeceuticals have forms of retin A in them, but not at the same concentration.
Okay, so as a consumer, when we go and we buy these products, which are very expensive and promise to do a lot, how do we know whether or not what we're taking is safe and what we're using on our face, on our lashes?
Well, there are certain things the consumer can do. Look at the ingredients. So if a product says that it's allergy tested, that means that it's held to a higher standard, that it's been tested and most people will not have a reaction to it. You want to make sure whatever you're putting on your skin isn't filled with lots of dyes that could be irritating. There are a lot of products out there, and some of them are very good, that can really do what they say they're doing.
And who should we be buying these products from?
I think you want to make sure that you're buying a product that has been tested in some form, that comes from a reliable company. There are certainly doctor brands where they have been tested on a clinical basis. I think that we are entering a tremendous revolution in skincare, and today we know so much more than we ever did. People are living longer and they want to look better. And if there's an opportunity to look better without having surgery, wouldn't that be wonderful? And I think that that is really within our grasp right now.
Because the upside here, and we've seen this horrific story of Kanye West's mother, Donda West, and her plastic surgery. If there is an alternative to plastic surgery, that's something that would be better for women overall, correct?
Certainly.
Because your risk level goes down.
Yes, it's not enough even to pull the skin tight if the skin is leathery. So taking care of your skin just makes good sense. And you know, soft skin, smooth skin is healthier skin. Skin that gets cracked and dry is more prone to infection. So the wonderful thing about skincare is that we now can make our skin smoother and we can make it look better at the same time.
But you do recommend that we work with a doctor when we use these?
I think if you have any question, you should certainly ask your doctor, and you should become an educated consumer. We know with our foods, we have to look and see if they're preservatives. It's the same thing with the skincare. Look and see if there are dyes in it, fragrances.
So don't just buy into empty promises. Really do your research, because this is a growing field.
Yes.
All right, Dr. Michelle Copeland, thank you so much for being with us this morning.
Thank you.